Discover doctors' tips on diagnostic tests for heart disease in this informative video. Learn about the various tests and procedures used to detect heart disease, including electrocardiograms, EKG, ECG, which are essential tools in modern cardiology. These tests measure the electrical activity of the heart and can help identify a range of heart conditions, from arrhythmias to heart attacks. Stress tests, for instance, are designed to assess how your heart functions under physical exertion. During a stress test, you may be asked to walk on a treadmill or ride a stationary bike while your heart rate, blood pressure, and breathing are monitored. This test can reveal issues such as coronary artery disease or irregular heart rhythms that might not be apparent when the body is at rest. Echocardiograms, on the other hand, use ultrasound waves to create detailed images of the heart's structure and function. This non-invasive test can help detect problems with the heart's valves, chambers, and overall function. Angiograms are another critical diagnostic tool, involving the use of X-ray imaging to examine the blood vessels. During an angiogram, a special dye is injected into the bloodstream, making the blood vessels visible on the X-ray. This test is particularly useful for identifying blockages or abnormalities in the coronary arteries. Our doctor explains how each test works, what to expect during the procedures, and how they help in diagnosing different types of heart conditions. For example, during an electrocardiogram, small electrodes are placed on the skin of your chest, arms, and legs. These electrodes detect the electrical signals produced by your heart each time it beats. The signals are recorded by a machine and displayed as waves on a monitor or printed on paper. The doctor will analyze these waves to look for any irregularities that might indicate a heart problem. In a stress test, the patient is closely monitored while exercising to see how the heart responds to increased physical activity. This can help identify issues that might not be present when the heart is at rest. Echocardiograms provide a moving picture of the heart, allowing doctors to see how well the heart is pumping blood and to check for any structural abnormalities. Angiograms, often performed in a hospital's catheterization lab, involve threading a thin tube called a catheter through a blood vessel to the heart. The dye injected through the catheter makes the coronary arteries visible on an X-ray, helping doctors pinpoint any blockages or other issues. Understanding these tests and what they entail can help patients feel more prepared and less anxious about undergoing them. It's important to follow your doctor's instructions and ask any questions you might have about the procedures. By doing so, you can play an active role in your heart health and ensure that you receive the most accurate diagnosis and effective treatment possible. Whether you're experiencing symptoms of heart disease or simply undergoing routine screening, these diagnostic tests are invaluable tools in maintaining your cardiovascular health. So, take the time to learn about them, understand their importance, and discuss any concerns with your healthcare provider. Your heart health is too important to leave to chance. Understanding these diagnostic tools can help you be better prepared and informed about your heart health. Whether you're at risk or managing an existing condition, these insights will guide you through the diagnostic process. Subscribe for more expert health tips and heart disease management advice.